Right. Good evening, everyone. We are welcoming George Washington University School of Medicine and Health Sciences, and I will let them take it from here. Thanks for joining us.
Thanks, Megan, and everybody else for hosting me here today. Welcome to all of the students who are joining us. My name is Nathaniel Ropsky, and I'm the Senior Assistant Director of Admissions for the GW Med program. Throughout our presentation today, I hope to inform you a little bit more about what GW has to offer for students looking to get their doctorate in medicine. Please see here at the beginning that I have my email up on the first slide. I'll also have it on the last slide as well. So please feel free to take that down if you do have more questions moving forward, and if you do want to connect with us in a little bit more personal way. Hopefully, depending on how long the presentation takes, we should have some time at the end for Q&A. So please, feel free to come ready with questions. But if we aren't able to get to everything, you can definitely follow up with me via email as well. But yeah, with that, I think we will go ahead and get started here. All right, so our agenda today, we're going to be reviewing a little bit about the GW School of Medicine and Health Sciences, or SMHS as we call it. We'll talk a little bit about the curriculum of our med program, get into a little bit of the student experience that happens outside of the classroom. We'll talk a little bit about outcomes, the be all end all for everyone, and then we'll get into some of the more important aspects for those of you who are a little bit earlier in your process and thinking about applying to med schools. And then, like I said, we'll kind of end with questions from there. So throughout the presentation today, what I hope to do for you is to tell you about how our location, our clinical exposures, our concentrations, our emphasis on public health and policy, and our student community are able to differentiate us from other institutions of higher learning that have MD programs. So some of those things are going to be a little bit of buzzwords that we'll keep coming back to here, but hopefully you'll see what we think makes GW different and attractive for students who are interested in getting their doctorate in medicine. So to start, let's get a little bit of information about the school itself. So the George Washington University School of Medicine and Health Sciences seeks to graduate what we call physician citizens who are committed to local, national, and global public health service through excellent patient care, leadership, and advocacy. Basically, the term physician citizen, you'll see it all over our website. It's something that is really critical to us in what we are looking for in our students. Partially that's driven by our location, and partially it's driven by our ethos. But you can see on the slide here, we're looking for a specific type of person who wants to impact their communities at the smallest, most granular level locally, but also going all the way up to regionally, nationally, and internationally. So again, that's something that hopefully you'll see throughout the presentation today and kind of hear over and over as something that's really important to us. So to start with a little bit of an overview here about GW itself. So obviously we are located in DC proper. We're about 3 blocks away from the White House, if that can orient you. But the GW School of Medicine and Health Sciences was founded back in the early 1800s, in 1824. So we actually just had our bicentennial celebration, which was really cool. We're the 11th oldest medical school in the country, and actually the first in the nation's capital. We were one of the first to actually teach clinical medicine in 1853, and we enrolled our first female medical student in 1884, which actually distinguished us for decades as one of the only medical schools to admit and graduate women for a very long time. In the 1960s, we became one of the first to implement external clinical rotations around the DC area. If you've ever been to DC, you obviously know that the DMV exists. And so DC, Maryland, and Virginia all kind of, conglomerate around there. So we were kind of one of the pilot schools to, bring students out of just the immediate area for their clinical rotations, which is another thing that we're really proud of and still do to this day. Like I said, we're located in the heart of DC itself, just a few blocks from the White House. There are a large variety of national organizations and partners that are literally minutes away from campus. So you can think of things within the federal government itself, like the Smithsonian or NIH. You can think of things outside of that that are large, kind of non-governmental organizations like the World Health Organization, things like that. Many of them have either offices or are headquartered, just down the street from us, which is really great. We're located right across the street from GW Hospital, which is a state-of-the-art facility with both level 1 trauma and level 3 NICU credentials. It's got 385 beds with nearly 900 physicians and 800 nurses on staff, many of whom either work or teach at the GW School of Medicine and Health Sciences as well. The SMHS is also home to many other health-related degree programs, so not just the MD, although that is our flagship. We also have PA, PT, OT, medical laboratory and clinical management master's programs. We also work very closely with GW's Milken Institute of Health Policy and the Science and Engineering Hall as well. There is actually a dual degree option available. It's an MD, MPH that you can do if you are interested in something like that. Again, it kind of gets back to that physician citizen idea that I talked about earlier. The application will also give you the option to indicate your interest in attending our regional medical campus or our main campus for phases 2 and 3 of your GW Med experience. We'll talk a little bit about what that looks like here in the next couple slides, but I really wanted to emphasize that for Hopkins students because the Regional Medical Campus, or RMC, as we refer to it, is actually located in Baltimore. So that's something that can be attractive for a lot of folks who are in the area. So it's located at Sinai Hospital, which is part of the LifeBridge Health conglomerate, and it's in the Pimlico area in northern Baltimore. But Sinai Hospital itself was originally founded in the 1860s to serve the needs of Jewish patients and doctors who were excluded from obtaining care, practicing, or training at other hospitals. And since then, it's actually grown to meet the needs of that northern, Baltimore City community, and now houses a 483. Try to remember all these numbers, 483 bed teaching hospital. So the RMC is designed for medical students who desire to train in a more clinical environment that is committed to population health specifically. Students that choose to attend the RMC will actually solely be at that campus during their clinical rotations instead of having to travel around to many different locations for their clerkships like our main campus students are required to do. So if that is something that is of interest to you, already being, either from Baltimore originally or from the area potentially, or just, attending Hopkins now, the RMC is a recent addition to our portfolio and something that we're, really excited to share specifically with students from that area. So if you're interested in learning more about RMC, I'd encourage you to watch the recording of the RMC webinar that we have on our website. And I should actually mention as well, any information that I'm sharing here today can be found on the website. So of course, feel free to follow up with us directly or find the information there as well. But naturally, all this is just in one place for you now, but all this stuff you can find as well. But let's pivot a little bit here and next talk about the curriculum of the program. So the curriculum leading to the Doctor of Medicine degree is designed to provide you with a medical education that prepares graduates comprehensively for residency training, provides you with the necessary experience to select the next step in your career, and actually prepares you for professional lives of continuous learning in the medical field. So the actual curriculum itself is spread across 3 phases that go through the entirety of the 4 years. So you can see what each of these is here on the slide. Next, I'll give you kind of a nice little visual of it, and then we will kind of deeper dive into each of those 3 different phases from there. So don't worry too much about all of the specifics on this chart. I'm sure that your advisors are used to this as well. These are just here as a fence post for you. Don't get too bogged down in the details. But basically, look at this chart more so for the sake of the colors to indicate the different phases of the program. So you can see here that the fundamentals of medicine phase, the first one in blue, is all of year one and most of year two. All students will complete this 18 months of coursework at the main campus, whether you choose main campus for the entirety of your time here at GW, or if you choose to then go to the RMC, that first portion in blue, you're going to do that with everybody else no matter what. The fundamentals of clinical practice is the next phase. So that's in purple there. And it is at the end of year two and most of year three. So it runs itself just about a year, but kind of cuts, between year two and year three of the program. Most of that time is where you'll be doing your clerkships. This is when the GWMD students will move to the regional medical campus or remain at the main campus, depending on which one you indicated. That's what that little red outline means on there as well. And then finally, we have the transition to advanced clinical practice in green. So this will take place at the end of year three and then basically all of year four. Again, you're still split between RMC and main campus, again, depending on which one you choose. But that gives you kind of a quick overview of what everything looks like. But it's a lot more useful, I think, to go through all of these, in a bit more detail for you as well. So again, phase one, fundamentals of medicine, most of all of the first year and a good chunk of the second year is curriculum that blends organ system-based blocks. So think like CPR, I3, things like that, with active case-based small group sessions. We're prioritizing both real world skills, so formats about clinical reasoning, cultural competency, things like that, with kind of the meat and potatoes of your baseline in the classroom experience and getting those medicine fundamentals. The clinical apprenticeship program that you see on one of the bullet points there, that emphasizes early clinical learning by matching first-year students with clinical preceptors and allows you to complete a clinical apprenticeship in that physician's office throughout the entire preclinical phase of the curriculum. Oftentimes, we match folks directly within the GW hospital, so that it's right there for you, across the street. But we also work with other outside entities as well, if you are looking to, again, kind of spread your wings a little bit more than just going across the street on campus. But during this time, students have the opportunity to observe the practice of medicine and begin to kind of integrate.
I just messaged you back and they said that they were not. Okay, that sounds.
I do that all the time whenever I'm on these things, no worries. But like I was saying, so students, while they are doing their clinical apprenticeships, they have the ability to basically observe medicine in practice and begin to integrate what they're learning in the classroom with the other segments of the curriculum as well. Also during this time, you'll see that there are a lot of opportunities for out of the classroom experiences. We'll get into a little bit more of those later, of course, because they don't really fall into the curriculum as much. But, the best way to think about your medical school education is that you're least busy in year one, and then it just kind of ramps up. So we kind of talk about some of these things as falling under that like fundamentals of medicine time period, just because this is when you're going to be taking advantage of some of those things more so. So one such example of that is that we host a lot of public health summits during which students collaborate with national experts to develop innovation, in research and action plans to kind of address public health issues. Examples of that being summits that we've had on how physicians can create an AIDS-free generation, or how physicians can help eliminate childhood asthma. You can actually see that Dr. Fauci attended one of those summits as well. And then finally, during this phase, students are also integrated into our Clinical Learning and Simulation Skills Center. And it's good to talk a little bit more about that. So this center, which is also known as the Class Center, provides one of the most innovative educational environments at the school, and we also like to say in the nation as well. It's very hands-on, and students are able to supplement their classroom learning with comprehensive clinical exposures, feedbacks, and evaluations that prepare them to become both technically adept and compassionate caregivers. So again, it kind of gets back to what we've talked about here in the fundamentals of medicine. You're learning the tools of the trade, but also, the practice of medicine as a caring physician and advocate. So the rooms inside the class center include, but are not limited to, a simulated ICU, operating labor and delivery rooms, procedural skill labs, and standardized patient rooms as well. So beginning in the first year, students get extensive experience developing patient communication skills and cultural competency, like we were kind of talking a little bit about on the last slide. And one of the ways that we do that is through the class center with those standardized patients. They're actually played by actors who will come in, and act as, patient A, patient B, things like that. And it gives you, again, kind of that exposure to people from different backgrounds, different walks of life, different cultures, but in a safe space before you go out and do it in reality. And this, for us, this mix of both kind of human and non-human simulation really allows for a wide range of hands-on learning early in your medical education before you get to those kind of more, hands-on clinical phases. Okay, so the next portion, phase 2, we have our fundamentals of clinical practice phase, otherwise known as your clerkships. So just to reiterate, this is where you would transition to RMC if you indicated that on your application. Otherwise, you would stay, at main campus. So for those who are transitioning to the RMC, remember earlier that I said that all clerkships will be held at that Baltimore campus, while the GW students staying at the main campus will have clerkships throughout various GW affiliated clinical centers and partners in the DC metro area. And that's an exhaustive list, honestly. There's a lot of them. So we tend not to go through them all because they kind of change a little bit at the margins here. But you can visit our website for a more extensive list of not only what those entities are, and also within this actual fundamentals of clinical practice curriculum, you can also look at the electives that are available, because you can see there is some elective coursework that takes place during this phase. So these are a handful of the different places or types of places that the clinicals occur. Again, we don't get into every single one of them, but it is, I think, worth mentioning the different options here. So clearly, if you're doing regional medical campus, everything's happening at, Sinai Lifebridge Hospital. But if you're here on campus, again, that's where a lot of those external partners come into play, and ones that you may not even think of. So, we mentioned NIH as being a big partner of ours, but Walter Reed is also a big one as well. Children's National is a big partner. The Dean of Admissions, who you might have seen, Dr. Katroulis, he actually works at Children's National as well. He practices there. But like I said, the list is not extensive or comprehensive, but it can give you a sense of where you might spend, a few weeks on a clinical rotation, depending. Okay, so the third and final phase is the transition to advanced clinical practice. And that begins, again, at the end of April of the third year and then runs up until graduation. And it will really set you up for success for residency. So here's an example of what this phase might look like in practice. I should have mentioned this before as well, but just like in the previous phase, the order in which you take these classes may vary, or not, I guess not just classes, but the order in which you will do each of these individual blocks will vary a little bit. So this is just giving you kind of the modal outcome, and give you an example of what things might look like. But ultimately, you may not start with neuroscience and, end with electives or anything like that. Really just depends on, where you are going and what fits into your individual schedule. And we'll get into on the next slide what might affect some of those choices and affect when some of those things happen for you. But one of the ways that you change your schedule, and one of the ways that you're able to kind of make the MD program your own, is talking about the scholarly concentration program. So obviously a lot of institutions have scholarly concentrations within their Doctor of Medicine programs, and we are no different. The one way that we are, I would say, different in many respects within our scholarly concentrations is that we do have a health policy one. So again, it kind of harkens back to what we were talking about before at the beginning in terms of what sort of students we are looking for our program. And one of the key things that we care about being in the nation's capital is folks wanting to be aware of what is happening right down the block in the White House, and be aware of how Congress, the White House, the national government, things like that are affecting healthcare in this nation. So that is not to say that everybody does health policy or that you need to be interested in it or want to choose it, but that is one of the ways that GW sets itself apart as an institution, I would say, especially compared to other schools that may not be in the same area as us regionally, or may not have the same, finger on the pulse of what is going on, nationally within the healthcare policy realm. But any of these 8 concentrations that you can choose from, they are all going to be great in their own way. And although we won't get into every single one of them in detail, again, there's always more information to be found online as well. So these are basically a supplement to the general academic and professional curriculum that is found throughout each phase, and they're a great way to stay engaged academically even as you go farther along into the later phases of the program. And each concentration offers enrichment opportunities as well. So things like summer internships, monthly lunch lectures, individual research or scholarly projects, and fourth-year electives that are more tailored to that individual concentration as well. But they're all aiming to broaden your healthcare perspectives and leadership skills. And most students have chose their concentration by October of their first year. So it's not something that you have to know going into it. And honestly, it's not even something that you have to do. We say that it is it's not a requirement, but basically everyone does one. I think last year, 98% of students did a concentration. So it is something that most people will end up doing. And if you are admitted to the program in the future, you'll have the opportunity to attend and view webinars on those concentrations to hear a little bit more about what each one entails before you ultimately have to make that decision. So another way to stay engaged academically is through the many research opportunities that we afford through GW. So this, again, basically like everything, is by no means exhaustive, but hopefully can give you a sense of the many ways in which we conduct research here at the university. Sometimes students continue the work that they started before medical school, either in their undergrad or their post-bac or, whatever it may be. Sometimes they like to try new things through their concentrations. But all students in concentrations will actually do research that is specific to that concentration, but you do not need to be in a specific concentration in order to do research. Hopefully that makes sense. So whichever one you're in, you will do research in that realm, but you can also do things outside of that concentration as well. In addition to the various institutes and research centers that we have both at the main campus and the RMC, we actually also host an annual research day to showcase what GW SMHS community is working on in any given year. So our little poster presentations and little talks. But it's a really great way to showcase what's going on, not just within the MD program, but with all of those other programs that I talked about earlier as well. And finally here, we are also continuing to grow as an institution and continue to expand our outreach to continue to help the community that we serve and live in. So these are just a couple examples of things that either just happened or are happening here in the future. So in 2019, we actually opened a helipad at GW Hospital. That's, 6 years old at this point, but that's really something that was, very important for us to help kind of expand access to life-saving care in the region. The biggest success story of late, and you can tell because I've been talking about it a lot already, is the RMC. That was actually only established in 2023, so it is a relatively new enterprise. So, we're still kind of, in the best possible way, building the plane as we're flying it, because we have not graduated anybody from RMC yet. But again, if you are interested in, being a part of that, kind of from the ground up, there's a lot of exciting energy around the RMC right now. And again, it kind of gives students the opportunity to train in a community-focused health system with a strong emphasis on, primary and continuity care in a population health environment. That is really kind of the RMC's, raison d'etre. It's like the main focus. And in that vein, of kind of still continuing to expand, we are next trying to open up another regional medical campus, the Cedar Hill Regional Medical Center, that will be at St. Elizabeth's. And that is in Southeast DC. So we're trying to open that to improve access to high quality integrated care. And that will hopefully, knock on wood, be situated later on this year. So something that might be available for students for next year's cycle as well. But TBD, no promises on that yet. Okay, so I know that was a lot on the curriculum, but oftentimes it's important to really give you the academic focus first, I think, because all of this other stuff is obviously super important to your time as a medical student as well. But we want you to know that you're in it and taken care of within the classroom first. So next, we're going to pivot a little bit and talk about things outside of the classroom. The student experience. So the learning communities that we offer are intentionally developed longitudinal groups, meaning that they kind of last from the beginning to the end of your program, that are groups of faculty and students that aim to basically enhance your medical school experience and maximize your learning. So each learning community has about 45 students in it. Kind of varies a little bit year to year depending on how many students we bring in, but usually it's about 44, and it is led by several dedicated faculty members and an advisory dean who will support you in career advice, elective scheduling, concentration choices, residency matching, research and development, all that sort of stuff. And again, you're sticking with those folks throughout. So even though you're part of the whole GW, MD class as a whole, you do have that smaller, group who you're coming in with, who you kind of stick with throughout your time here. We also offer more kind of peer-driven and one-on-one opportunities. Again, this is not an exhaustive list, but it gives you an example of the sorts of things that we do to make sure that you're, coming in here with all the right resources and ready to hit the ground running for the most important part, your classes. So some of those opportunities are our big SIM program that matches each incoming first-year student with a second-year student before orientation to serve as basically like a guide and mentor as you adjust to medical school. Though there are many mentorship opportunities, one that is really important to mention is that for our local colleges and universities, we actually have a list of current student liaisons who are alums of your institution that basically serve as a second point of contact for applicants who want to learn a little bit more about GW from the student perspective. So if you would like to get in touch with a liaison for Hopkins, just shoot me an email and I can introduce you to one of those folks. But that can really be a great way to get the perspective of someone who came from your school, maybe not the exact same program, but has been through it just like you, and hopefully can provide some helpful guidance and serve in a more kind of peer mentorship capacity in that regard as well. So please, if you're interested in meeting with the GW liaison, or GW Hopkins liaison, I guess I should say, just let me know. Okay, so other things to basically help with student learning outside of the classroom and kind of build on that student experience. So one of those is the Office of Diversity and Inclusion, or ODI, as we call it. So the efforts and initiatives of the ODI are focused on promoting basically a positive and institutional culture and climate, creating a community of excellence that makes everyone feel welcomed. That's one thing that really is important to us as an institution. Not only celebrating diversity, but also bringing in diverse perspectives, not only from our student body, but also where we send folks out into the world as well. We're benefited by the fact that we're in the nation's capital, and that is a large melting pot of many different, peoples, cultures, and a lot of that bleeds into medicine as well. So ODI is really kind of a critical example of the things that are going on behind the scenes, not just for the sake of the MD program, but for SMHS and GW as a whole to really celebrate the differences of folks that come into our orbit. One good example of ODI at work is our Anti-Racism Coalition, or ARC, which aims to help students, faculty, and staff better understand concepts such as anti-racism, structural racism in medicine, and again, kind of builds on what I was talking about earlier in phase one, that fundamentals of medicine, kind of building that, cultural competency within, your individual medical practice as well. Okay. Other good things going on outside of the classroom that can hopefully supplement what you're doing here at GW. If you are looking for meaningful experiences that take you abroad, there are a whole big variety of opportunities for medical students to enhance their understanding of healthcare and medical care delivery in other countries throughout their time here at GW. So all students who do the international medicine concentration, so you would have seen that on the previous slide, that's one of those 8 that you could choose from early on. But anybody who is in the international medicine concentration will go abroad multiple times. But all students, regardless of whether they've chosen that concentration or not, will have the opportunity throughout medical school to go to another country. It's not to say that you have to, but it's a really cool opportunity. And again, kind of gives you, that broader perspective that we're looking for, not only coming in, but also sending students out into the world as well. So this can include a lot of different things. It might involve targeted missions through partner organizations. So you can see that we have some in Guatemala, in Haiti. You can see opportunities to take classes at partner institutions around the world as well: Brazil, Japan, Lebanon. And also you can do international rotations in your 4th year as well. So that also takes you to many different places. And those partner institutions, those missions, those rotations, they are dynamic. They're always changing. So even if you don't see one on the list that is of interest to you now, I guarantee you that there might be something that is of interest to you later. So one of the best things about education, this is me kind of on my my own little soapbox here, but I think one of the best things about education is allowing you the opportunity to learn diverse perspectives and to be able to really go out and explore the world through the resources that a school has to offer. So please, if you can, take advantage of one of these international opportunities, because they can really be eye-opening and life-changing in many awesome ways. So of course, we get folks involved closer to home as well. So whether you are looking to interact with others with similar career interests, or searching for an opportunity to serve a little bit closer to home, or even you're craving an outlet after being burned out from a difficult class, students in the SMHS can get involved in dozens of different student organizations and associations, many of which are not just limited to the MD program as well. So it's a really great opportunity to connect with folks, in other graduate programs programs, even undergraduate degrees as well. And if you don't see one that you're looking for, you can always make one yourself. So as per usual, if I put all of the student organizations on the slide, there'd be no room for anything else. So a lot of cool different opportunities that hopefully you can take advantage of while you are here. There's also a number of opportunities for students to get involved in their community with service projects and initiatives. So if the last slide was, kind of more like student-focused organizations, usually from, specific interest groups, backgrounds, if you want to sing, join the vocal cords, things like that. These organizations are a little bit more service-focused at the end of the day. So for example, one of the most popular service organizations that students tend to be a part of is the Healing Clinic, which provides comprehensive primary care and social services to residents of DC and Maryland's most underserved areas, regardless of their insurance status or their ability to pay. And what's also really cool about the Healing Clinic is that it is entirely student run, and it's a free clinic, like I mentioned, and the mission is to basically bridge patients who were not previously part of the healthcare system to formal care, either in our own clinic or at one of our community partners as well. So that example I gave earlier about the other kind of like regional campus that we're opening at St. Elizabeth's, they're a big partner within the Healing Clinic specifically. So really cool opportunity. And a lot of folks in their applications talk about the Healing Clinic. Not to say that you have to, but I think it is something that is really a big draw for students, and something that really, showcases, I think, GW's mission and also GW's students at their finest. Okay, so we've talked about inside and outside of the classroom. We've done, soup to nuts, start to finish of the program. So now let's get very briefly into the most important day of the program, which is match day. And it is what your whole time at GW is basically building towards. So at the end of the day, our students are matched all across the country into a wide variety of different programs for that next step in their career. Though many folks tend to stay local or regional, we have had success all around the country. I'm not sure how good this map here does at showing you all that different stuff, but you can see there's that little smaller insert showing folks staying in the DC metro area, but we do see a lot of folks go along the eastern seaboard and even branch a little bit farther out as well. If you want to do a deeper dive into the results, please feel free to go to the website and do so. We don't hide our match rates. We don't hide where people, are eventually matching. It's important information for you, obviously, because you want to know that you're going to be successful when you graduate from this program. But it's also a little feather in our caps as well, because we want to show how great all of our graduates are. So I know that this usually tends to be a question, maybe not in these sessions, but anytime you talk to a student, you tend to get this question. So I might preempt some folks here. So our match rate does vary a little bit year to year, but in the past 5 years, it's always hovered between about 94 and 98%. So usually the mid 90s is what we're kind of averaging out to. Obviously, higher is always better. Last year, it was 97.4%. So again, on the higher end of that usual range for us, but that means the vast, vast, vast majority of students are matching. Okay, so we're going to pivot once more here and talk a little bit about the application process. So, it wouldn't be an admissions presentation without giving, our 2 cents about the application process, because all of this stuff, hearing about it is all well and good, but if you don't get into the school, it doesn't help you. So, we want to make sure that you're set up for success when you go to apply to GW. And so we believe that it's important for you to understand the mission of our Committee on Admissions, in addition to just looking at the application process itself. We'll get into what that looks like here on subsequent slides. But again, to reiterate what I started with at the beginning of the presentation, we're looking for future physician citizens who excel in patient care, leadership, advocacy, and scholarship, scholarly inquiry. We value a lot of different attributes in our students, but things like dedication, integrity, resilience, as well as diverse experiences and academic excellence. As with all this stuff, this slide is not exhaustive, of course, but please use it as a guide to see the types of qualities and experience that we are looking for in our applicants. And please note, like I said, all this stuff can be found on the website as well. You know, don't feel as though it's proprietary and you got to write all this stuff down and say, "Ooh, I got to mention physician citizen." You totally can. That shows that you've done your research, and we appreciate it. But you know, just think about these different attributes, experiences, and achievements, and how it kind of builds upon your individual unique story, and share that with us, because we really do care about, you know, learning about you individually as a person, in addition to just, you know, an applicant. So a little bit about our class profile here. So our students tend to come from a wide variety of backgrounds and lived experiences, as is typical of, you know, many different institutions that are in larger cities and have, you know, very selective, you know, admissions procedures and practices. But our students have earned many different types of degrees within the sciences. So think the heavy hitters: bio, chem, neurobio, biochem, physics, things like that. And in the non-sciences as well: English, econ, music, history. You know, again, we tend to get a non-zero amount of folks coming from like political science and public policy, and even public health, things like that. But they also come from a wide variety of professional backgrounds in addition to their academic backgrounds. So this is just a blurb from folks who came in this past year that I put together, but they are EMTs. Duh, makes sense. They're teachers, they are parents, they're Peace Corps alums, they are volunteers at the Special Olympics, they're veterans, White House interns, athletes, and so much more. And we want to see what you individually bring to the table as well. So to kind of, you know, give you the sense here, age range, I mean, you can be, you know, probably not younger than 19, maybe. Who knows? But, you know, 19 to usually about 40. Naturally, the range varies, but usually that is kind of the typical entering class. Usually we see folks coming from a majority of states around the country. And we tend to see usually about 75 or so colleges represented, with those kind of varied majors that I mentioned. I'll get into a little bit more about this when we kind of wrap things up as well. But Hopkins is one of our heavy hitters in the best possible way. You know, the fact that you all are so close to us means that, you know, usually in any given class, we tend to get double digits from Hopkins itself. So that is another nice benefit, I think, of kind of making the transition over to GW, is that, you know, you're usually coming in with folks who maybe you didn't know them personally, but, you know, most likely you, you know, knew them in some capacity at your time at Hopkins, and you're kind of coming in with a pre-built community, which is really great. You can see here what the average MCAT and GPA are. Now, again, that is average, so that does not mean that, you know, we don't bring in people with something, you know, lower than a 512 or lower than a 3.7. Things are read holistically. Naturally, we do have, you know, lower bounds. So usually if you have an MCAT of 500 or below, and or a science GPA of 3.0 or below, then you would not be considered competitive for the program. So to speak a little bit more about kind of minimum eligibility and requirements, so at a minimum, you have to be a US citizen, permanent resident, or DACA recipient, or a Canadian citizen with an undergraduate degree from an accredited US or Canadian college or university, like Johns Hopkins. All applicants are required to submit the MCAT, and the scores need to, or not the scores, the exams need to have been taken between April of 2021 and September of 2024 for this current cycle here. Now, obviously, we are, you know, past the 2025 cycle for the sake of this presentation, but that tends to be pretty similar from year to year. Finally, we of course like to see evidence of clinical experience, service, and research. That can mean a lot of different things to a lot of different folks, but we want to show that you've been doing stuff more than just acing your tests and acing your grades. We want to see that you are really kind of living into that physician citizen ethos that we always are talking about. In terms of competencies, here are the recommendations that we have for biology, physics, chem, and laboratory experience. Varies a little bit on the margins, of course, as it does with any institution, but generally at a minimum, you're looking at, one class or so if it's something a little bit more granular like physics, or 1 to 2 years of subjects depending on the individual college curriculum. So of course things like biology are going to be a little bit more integrated. Things like chemistry are going to be a little bit more integrated as well than something like physics. But it's pretty much the standard for most pre-med tracks at most universities. So don't read too much into this and think, oh my gosh, am I meeting the requirements? Chances are, if you're working with the great advisors at Hopkins, you're on the right track and you're meeting these minimum requirements that we share. But just make sure that you're meeting grades as well. Okay. So other pieces of the application puzzle. So we do recommend, but do not require, that you take the preview exam with the AAMC, which is a situational judgment test that is designed to simulate your ability to assess and respond to unique and difficult situations that might come up as a physician. Although it's not required for the current cycle that we are finishing up right now, there's a possibility that we will require it for the 2026 cycle and beyond. GW is one of the schools that is really kind of leaning into the preview exam, and there are other kind of larger institutions that are doing that as well. So TBD if we're requiring it for subsequent years, but we should know pretty soon whether or not we will be requiring it moving forward. But just make sure you check the website, or you reach out to us when it does come time to apply, just to make sure that you're getting it done if it is ending up being a requirement. But one thing that I should mention is that if it does not become a requirement, and if it still is just recommended, there's no negative impact on your application if you don't end up taking the preview exam. So know that as well. Okay, so we're almost done here. I'm sure that I know that when I'm at the end of these presentations, I tend to think, wow, that was a lot of information. So don't worry, we are on the back end here. But steps that you need to take in order to apply. Obviously, you'll submit your application through AMCAS, the AAMC's Med School Common App, basically. Then we will automatically send you a secondary application if you indicate to us that you're interested in GW specifically. On that secondary, we're going to ask you a series of kind of more GW specific questions. One example of that being, which campus you'd like to be at and considered for. So you can actually see what the options are there on the slide. But again, that kind of harkens back to, RMC versus main campus. In terms of letters of recommendation, we recognize that, different institutions and different degrees, so, undergrad, grad, post-bacs, things like that, all tend to have different systems in place. So we're totally fine with either a committee letter or 3 individual letters of recommendation. Just make sure that if you go the route of the 3 individual letters, that one of them is from a science professor. And like I had said before, for the 2025 cycle, students could submit their MCAT scores for exams that were dated from April of 21 to September of 24. Like I kind of mentioned, that doesn't tend to vary much from year to year. Usually it is just, change the 1 to a 2, etc. Change the 4 to a 5. So that's likely going to be the case for us for next year's application cycle as well. In terms of the application timeline that you should be aware of, so AMCAS opens every year on May 1st for every different institution. So if you indicate interest in GW, we will start receiving that information in July from AMCAS, and we will automatically send you the secondary once we receive that information. So the sooner we get it, the sooner we read your application in full, and the sooner we send you that secondary. So, if there's one thing that every admissions office is always going to emphasize to you, it is, the calendar is your friend, and earlier is always better. Every completed application, I should mention, is read by a member of the committee, like me or one of my colleagues. So this is something that is, obviously important to all different institutions, but it's especially critical for GW because we tend to have some of the highest applicant numbers in the country. So this year, we actually had 17,000 applications. So 17,000 apps for about, the 185 or so spaces that we have. So that is not meant to intimidate you in any sort of way. Of course, a lot of institutions are very selective, but it is more so meant to tell you that every single application that is completed with their secondary, eyeballs are on them. We read them. So, make sure that when you are writing stuff and make sure when you are targeting schools, you're very specific to that institution, because those are the sorts of things that are going to, help set you apart and show that you've done your research and you're not just saying, okay, here's my, 15th school that I'm applying to. Let me just send the same thing. So just know that we do look at every single application that comes in. Throughout that kind of period of like mid-fall through early spring even. But in mid-August, we'll begin our interviews on a rolling basis. And then September 30th is the MCAT deadline, like I'd already mentioned earlier. Early October is when we start to release our early decisions. And then October 15th is when we start releasing our first regular decision. So no matter what, whether you apply early or not, that kind of, early to mid-October range is when our first regular decisions start coming out. From there, November 15th is the primary application deadline for AMCAS. And then finally, December 12th is the GW secondary and supporting materials deadline. So this timeline does not tend to vary much from year to year. Some dates may change by a day or two, just depending on if they land on a weekend or not. So consult the website as it gets closer to confirmed deadlines, and just ensure that all of your materials are submitted, well ahead of time and within a timely fashion. Just know that we don't make any exceptions for late applications under any circumstances. So friends don't let friends wait until the last minute to apply. Just make sure you give yourself, a lot of time to do so. And then kind of rounding out the application side of things here. So one thing that we do make exceptions for, though, is for the institutional policies that came as a result of the pandemic. So I know we're kind of getting to the point almost of phasing out of that for those who, are going directly from undergrad into their MD program. But just know that we honor institutional changes for spring 2020 through summer of 2021 that were in place due to COVID restrictions. So, pass fail, online coursework, things of that nature. Okay, so one final thing that I just want to end with before we pivot over, because we still have a few minutes here for questions, is just to mention what I've kind of said a couple of times here. So this is our most recent class, proudly representing all of their undergraduate institutions. I'm sure if you squinted and zoomed in, you'd see a good number of Hopkins folks on there. So, I actually ran the numbers out of curiosity before doing the presentation here today. So 8% of our incoming class last year was from Baltimore area schools, including 11 students from Hopkins itself. So, you are a mighty contingent of the folks who come to GW. We like to work closely with the regional schools in our area. That's actually why we're doing this presentation today. But just know that you have a community here when you're coming from down 95 to the DC area. So hopefully this has been an informative presentation for you, and hopefully it has either sparked or reignited some interest in GW moving forward. But the last thing that I will do then is, of course, say if anybody has any questions, please feel free to ask them, and see that our information is here on this final slide as well, including my email, because I know that I'm a talkative person and I see that we're already basically up on time. So please, follow up with me, with any questions that you do have, and I'll be sure to answer them as well. But yeah, any questions that anybody has here before we end out?
Yeah.
Yeah.
I have one question. Thanks for the presentation. It was very insightful. I heard rumors that this School of Medicine doesn't accept applicants from the West Coast. Uh, is that something? Yeah.
Yeah, no, it's a great question. This is something that I will say, and is your name Renat?
Renat.
Renat. Okay. So Renat, I appreciate the question. One thing that I will say is don't listen to rumors. Don't listen to things you see on Reddit or see online. Talk to the folks who are doing this directly, because what I can tell you is no, that is not the case. Obviously, I'd say like a good chunk of our students comparatively tend to come from the East Coast. I think because we tend to see more people apply from the East Coast, but we do have a good group of students who either academically or even they were born there are from the West Coast. We get a good chunk of people from some California schools. So every single year there's at least a few folks from UCLA and Berkeley. We also get a lot of folks from Texas. So, not the West Coast certainly, but also not the East Coast. So yeah, I'd say that like probably where the rumor could come from is just the fact that as a mid-Atlantic institution, we tend to draw from what's close to us, So we do get a lot of people from like UVA and Georgetown and Hopkins and, UMD and things like that. And those are all such large institutions that we just get a lot of great qualified candidates from there. But it doesn't mean that we don't accept people from, outside of the DMV or outside of like the mid-Atlantic. I think we just get less applications from there comparatively, but yeah, there's definitely folks from those areas who can and do get into GW. I wish I had those numbers for you to share, but having read so many applications, I can tell you that for sure we get a lot of folks from there who are successful applicants.
So it doesn't. So like the preference for in-state applicants, how that doesn't affect the acceptance rates for out-of-state applicants?
It does not. No, we don't have a preference for in-state versus out-of-state at all. And interestingly, I mean, here's the other way to think about it too, is that in-state for us would be like DC, so even that is a little bit limiting. So there really isn't a preference put on one or the other. Like, not to give you too much of a look behind the curtain here, but, for my purposes, when we read an application, it's academics first. We are not looking at, where you're from necessarily. We're not looking at anything beyond your individual credentials, where you're coming from, what your interests are, and why GW is a good fit for you. So, you can be from Alaska or from Nebraska or DC itself. So there's no preference put on in-state students. I think another reason why you might see more students who come from our areas is that we tend to have like partner programs and linkage programs with like GW itself, so that draws more people from DC or from other like institutions in the area. Like we work closely with like HBCUs and things like that, so you tend to get some students from those areas who I think might look on paper like, oh, we're drawing more from that, we have a preference for that, but we do not. It's academics first, it's credentials first. But does that answer the question?
Okay, so quickly, where can I find data on the acceptance rates for applicants from California?
I can get that for you. If you don't mind, send me an email just to remind me, because then it'll be in my brain and in my inbox. Send me an email and I can get that for you.
All right, sure. I wrote down your email. Thanks.
Perfect. And I see that we have another question here in the chat. So could you please talk a bit about if there are research opportunities available for MD students to pursue? Yeah, of course. I can go back to that slide as well, because I talked a little bit about the research side of things. I have so many slides. Okay. So yes, there's a lot of different opportunities for research that MD students can pursue. So you can see some of those institutions and research centers that are here on the left side of that slide. So students actually have kind of a soft requirement to do research through their individual scholarly concentration. It tends to get built into the curriculum. They have basically like a capstone that is a research presentation that they'll undertake that is through their individual concentration, but a lot of folks will do stuff on top of that as well. So there's a lot of internal and external research partners. So those centers are the internal ones, but we do tend to see a lot of folks go external as well and work with some of the kind of leading research institutions in the area. NIH I mentioned before. HHMI is another big one as well. So yeah, there's a lot of great research opportunities for people to undertake here. And I see that we are, oh gosh, they all came in right at time.
Yeah,
Okay.
I think we will have to wrap it up because we are trying to keep to time and let everyone get on with their night. But because you shared your contact information, then students can still reach out with you with those last questions that they have.
Of course. Yeah. Jose, Zandy, please feel free to reach out. I'm sorry. I'm a talkative person, but yes, Megan, please keep us on time.